Otjinene is a small village in the eastern part of Namibia, about 150 kilometers from Omaheke's capital, Gobabis. During the height of the coronavirus pandemic, more than 70 inhabitants died from the virus. It was a wake-up call for the community to do something. Villagers in the Otjinene constituency contributed money, while some locals put together health equipment and food.
So it's seriously something big that has happened in the constituency in terms of making sure with the COVID-19 does not kill our people at the rate it used to. So every village in Otjinene contributed 500 Namibian dollars. That also made, as I have said, the first week we collected 250,000. And now when the center is up and running, community members are coming up with cattle, small stock, just for making sure people are fed at that center. And I think it's a good initiative, and if all other constituencies as well can, copy what Otjinene has done, it will be something good for saving the lives of the Namibian people.
The end result was an isolation facility in an attempt to reduce the death rate at the village.
First, people were losing lives. You are just hearing a lot of people died in Katima or maybe in Gobabis or maybe in Otjinene, but they were not putting faces to the people. Now that everybody at home is saying, no, I lost my son, I lost my daughter, I lost who, people really felt the hardship or maybe felt the heartbreaks. So that's maybe one of the things that really motivated them. Let's try to meet the ministry halfway.
Shemaine Upendura is the manager at the facility, and she says the villagers decided to step up simply because the pandemic hit too close to home. At some point, all 12 beds in the facility were occupied, but when our news crew visited the center, only 4 high school learners were isolated here. So far, no one in the facility has died from the virus, although a learner in critical condition was referred to the center some time ago. Upendura says the best part about working at the facility is having to discharge a patient after recovering from COVID-19. At the moment, the isolation center needs a full-time doctor, as the only doctor on call is a private practitioner who caters for the 2,000 villagers.